For many people, a lower jaw denture doesn't stay in place, it makes eating impossible, and it constantly slips out or even falls out while talking. Visiting children or grandchildren becomes stressful because the denture could fall out at any moment. It's just another reason to feel anxious and embarrassed. The tongue moves the lower denture because the mouth has become crowded. There were no teeth before, and now a removable denture has been added. Many people mistakenly believe that nothing can be done about a lower jaw denture and that it supposedly doesn't stay in place for anyone. So they do nothing and suffer for years. But in reality, there is a solution. Right now, I will tell you and clearly demonstrate on a real denture the main methods from simple to more serious ones. We'll see how effective they are and why the lower denture might not stay in place. Let's start with the main point. Why doesn't a denture stay in place on the lower jaw? In fact, there are only a few reasons, and they are very obvious. The first reason is, of course, the design of the denture itself. That is, the denture, as you can see, this is a lower denture. It's shaped like a horseshoe. It has a small surface area, and it stays in place only thanks to this indentation. People usually call this the gum. So the height of our gummits, the height of your gum, that determines how well the denture is fixed. The less gum there is, the worse it holds. Let me tell you more. Sometimes, especially with lower jaws, patients come in and this ridge, this little roll, this gum is almost gone. And sometimes it's just a flat surface, and that happens too. In such cases, it's impossible to help the patient with the removable denture. That's it. It's simply not possible. With this denture as an example, we can see very clearly, if you pay attention, this denture has a gap here with what we call a clasper hook. So our patient has a tooth on the lower jaw. As you can see, here it is. This is exactly the case where, to make the lower denture hold better, we try to preserve every single tooth. By the way, this is something we've also talked about in our videos, and here our denture fits right onto and is fixed to that tooth. If you didn't have this tooth, the fixation would be, let's say, quite difficult. Now, for comparison and better understanding, this is what a removable upper jaw denture looks like. See how bulky it is. And you might think that such a delicate small denture wouldn't hold well, while this large one would stay in place just fine. This is all related to the so-called valve zone. Here it is, located right here. This valve zone, the patient secures it in their mouth by making what's called a swallowing motion, creating negative pressure in the mouth, and the denture simply adheres very well, without any additional means, sticking directly to the soft palate. Sometimes it also atrophies, and the valve zone becomes less pronounced, so the upper removable denture holds less securely. But this happens much less frequently than it does with a lower jaw denture. Of course, there are also creams. That is, we apply a special cream directly onto the denture itself, and the patient secures it onto their jaw, which can provide additional fixation. We can also use these kinds of strips or pads for additional fixation. There are quite a lot of them here. It's a whole pack. So you open them and use them one at a time. In the same way, you apply them to the denture or to the gum, and accordingly, this gives your denture extra fixation.
But is it really necessary to save every single tooth you have? Because, for example, even on this denture, it will kind of hold for some, well, apparently not a very long time. So maybe it would make more sense to just remove that tooth right away and make a full, complete denture so that it would be more solid, wouldn't break, and nothing would happen to it. Or is it actually really better to save the tooth and use it as support?
Absolutely. The tooth should be preserved. What you mention over time, of course, this clasp, which can be metal or composite like acetal, this clasp, this hook that we use to attach to the tooth with constant putting on and taking off, it doesn't exactly injure the tooth, but it does create a certain impact. And after some time, which happens quite often, this supporting tooth, as we'll call it, becomes unusable. It either becomes loose or thins out. That's why sometimes, by the way, a crown is placed on such teeth to extend the lifespan of the tooth and, most importantly, to prolong the supporting function of that tooth. After some time, of course, we will lose it.
And if it falls out, will I have to redo the prosthesis all over again?
If this tooth happens to fall out, it's actually much simpler. It's a quickly solvable problem, even if it's not just one tooth. There are prostheses where the gap is as large as 3 teeth. No problem. We weld it, add a tooth, do a rebase, and you'll have the same prosthesis, but now with the new teeth added. I would like those patients who once had dental prostheses installed to share their experiences. How did they feel right away on the first day after getting the prosthesis? How did they get used to it? And what difficulties did they have to face? Write in the comments, I would be very interested. Everything that concerns our prosthesis, whether it's a lower dental prosthesis or an upper dental prosthesis. It might seem like this is already a finished construction, you've received it, and that's it. But in reality, of course, that's not the case. Be sure to come to the doctor for a checkup once a year, just for a preventive checkup. It often happens that over time, even with prostheses, our gums, our bone, our ridge will inevitably atrophy and recede. That's why there is a procedure called relining. That is, the doctor takes new impressions and adds material to your existing prosthesis, or on the contrary, removes some. Relining also helps improve fixation and makes the prosthesis more comfortable. It can and should be done, but only the doctor decides when. So be sure to come in for a checkup once a year with your treating physician, your prosthodontist. If, after trying all the suggested methods, fixing pads, our various gels, creams for securing the prosthesis, or even relining the prosthesis, none of them have helped, and unfortunately the prosthesis still won't stay in place and you're truly suffering, then unfortunately you have only one option left: implantation. That is, you simply need to, so to speak, prepare yourself financially and emotionally and get ready for implantation, because it's the only option. Here we can, let's say, reduce the cost by placing just 2 implants and making a securing prosthesis directly on them. This will provide additional support. Just like in the example of this prosthesis we have here with you, we place 2 implants and attach the prosthesis directly to them. This will be a removable prosthesis, the so-called button type. Once it's fixed, you can wear it comfortably. Honestly, this will really help you and significantly improve your quality of life. Or the second option is to use the so-called all-on-4 or all-on-6 technology. In that case, it's a fixed prosthesis and it's secured onto 4 or 6 implants with special screws. By the way, I talk about different implantation methods on my Telegram channel. Follow the link and subscribe.
And if someone gets a prosthesis on 2 implants, can they later upgrade to 4, like add 2 more implants and then get a fixed prosthesis?
That option or treatment plan does exist. Yes, absolutely right. You can place 2 implants, then the patient wears a removable denture for a while, and after some time we add 2 more implants, ideally of course 6, but at least 4. We add 2 more implants and then make a fixed prosthesis for the patient. We do have such patients. Give us a like if this video helped you learn what to do if your lower denture won't stay in place. Subscribe so you don't lose this video. Take care of yourself and your loved ones.